Good morning, everyone. We will be starting the webinar now. First of all, welcome to everybody to this webinar on COVID-19, what next? This webinar is being organized and hosted by the Head Foundation in Singapore. We are very privileged and honored to have a panel of very prominent experts joining us today. In addition to myself, we have Dr. Brent Bauer from the Mayo Clinic in Rochester, Minnesota. We have Professor Yin Jinan from Jinan University in Guangzhou in China, and my friend Professor Zhu Liang from our own School of Public Health here in Singapore. So the way we will do this is that each of us will give a presentation of around 10 minutes of various aspects of the question of COVID-19, what next. At the end of our presentations, we may have a discussion amongst the panel members. And after that, we will open the webinar for questions coming from you out there who have registered. Let me just mention that you can submit your questions as the webinar proceeds. So feel free to do that. That's the flow of the webinar. So I'm going to kick the discussion off by giving my sort of 10-minute presentation. And this basically is going to be just a broad overview based on what we now know about COVID-19. And what I will try to do is, in a way, set the scene for the speakers that follow me. In other words, I will mention what we know now, and I will let my colleague sort of take up the issue. So let me begin without further ado. Okay, so what now? What lies ahead? And I'm going to start by asking, what do we know now? So the known knowns, according to the dictum of Don Rumsfeld. Any of you familiar with this? We know that countries are at different stages of the pandemic, and they are implementing different strategies to contain it. And some, as we know, are starting to ease restrictions, like New Zealand, like Vietnam, even some European countries. Secondly, some Asian countries have shown success in containment. China, Singapore, Vietnam are examples. But they have had to deal with second waves of COVID. And this is around community and local spread, newly imported cases, and fires sort of happening in vulnerable pockets of the population. Third, other countries in Asia may still be in the early or mid stages of the pandemic and continue to face big challenges. My own home country, Indonesia, is a very good example. A lot of problems right now, and for example, question about the true number of cases and deaths. And the other country that are facing these challenges, of course, is India with its huge population. Fourth, I want to just highlight these countries that have been, let's say, successful in containment. What have been their key actions? This is just an overall summary. It has been focused on rapid and extensive testing, followed by isolation and quarantine, movement restrictions, social distancing, contact tracing, and good public communication. Those are sort of the linchpin actions that I believe were the fundamentals of success in some of these countries. And just finally, in terms of disease severity, and these are just approximate figures, 80% of the diseases are mild, maybe around 10 to 15% require hospitalization, and 5% are severe disease, which requires ICU. And this happens mostly among the elderly, with underlying conditions, and heart disease and hypertension has been identified as one of the key underlying comorbidities, if you like. But just to summarize all of this, successful strategies so far has been based on speed of reaction and anticipation, critical to delaying the spread of the virus, what people are referring to flattening the curve. I just want to quickly now move on to what we don't know, sort of the known unknowns, okay? And there are a few of these. First, we still don't know what is the true transmissibility and pathogenicity of this virus. What actually is driving transmission, this famous R0? What is the actual mortality rate? Are there variants or different strains of the virus circulating in different parts of the world? Secondly, what is the importance, and everybody is talking about this, asymptomatic and pre-symptomatic individuals in spreading the virus? Third, are infected individuals immune from reinfection? This is something that's been in the news just this past 4 or 5 days. If they are, how long does it last? What are the correlates of protective immunity? Is it T cells? Is it antibodies? We don't know that. And finally, another controversial and difficult area, what is the value of this antibody-based rapid test in terms of its quality, in terms of its accuracy? You probably heard this morning that India rejected a bunch of tests from China because of worries about quality. And finally, this important issue of the issuance of immunity passports. Chile has done this as a means of indicating people being immune to the virus, and that has implications for regulations, obviously. So that's another important unknown. What value are those immunity passports? And of course, the big question, when will a vaccine or drug become available? And importantly, beyond that, are there other alternative strategies and interventions which can help to mitigate the crisis and complement conventional medicine? So some of these questions, I'm hoping some of my speakers will follow. Just to finish off, some other known unknowns. Are lockdowns and quarantines working? Is it time to relax the measures? What are the risks of a third wave or even a fourth wave? What will happen when the virus spreads to regions with weak, fragile healthcare systems, Africa, Latin America? I spent 13 years of my life working for the World Health Organization in Geneva, so I'm particularly sensitive to something happening in the developing world. Where did the virus come from? You know, as a researcher, as an academic, that's clearly a very important question. What is the animal reservoir and how did it jump to humans? Finally, what are the social, mental, psychological, and physical impacts of quarantines and lockdowns on communities and on individuals? Stress, depression, reduced immunity, poor nutrition, a rise in domestic violence, alcoholism, child abuse, etc., etc. So that's sort of just throwing it out there. And let me finish with just 3 final reflections on sort of COVID-19 and what next. First, we need policies and actions which ensure, number 1, strong health systems, socially responsible populations, political commitment, and good governance in order to achieve what I think is a needed balance between public health action, economic survival, and social equilibrium. Second reflection, we need to be prepared for the new normal. And this is my own personal view. I believe that we need to learn to live with the virus with the capacity to anticipate and fight fires whenever that happens. Will the virus disappear? Probably not, in my view. Probably it will become endemic with mostly sort of mild cases as populations develop herd immunity. So that's my view of the new normal, and I'm sure not everyone will agree to that. And finally, once again, because I used to work for the World Health Organization in my past life, we need now more than ever regional and international solidarity. We need to avoid unnecessary political polemic, blaming each other, all these conspiracy theories that are out there, and focus on the need for collective action based on trust, sharing knowledge and expertise, and the goal of saving humanity. Just one final slide. UN Secretary General Antonio Guterres said a couple of weeks ago, the COVID-19 pandemic is the worst crisis humanity has faced since World War II. My response to that is that at least in World War II, you can see the enemy. In this case, you can't, and that's the big challenge. Okay, so I've just sort of given you an overview of and sort of setting the scene. And I will now move on to Professor Swee Yang, my colleague here at the National University of Singapore. And as I mentioned, there have been countries that have been sort of lauded as being very successful in containment. Singapore has been mentioned probably as one of the gold standards, but I read an op-ed recently that from gold standard, it has sort of moved to sort of cautionary tale. And I think Li Yang is probably in the best position to tell us about the Singapore experience, especially in light of you know, what's happened in the last week or two, in the sort of illustrating the fact that we can't take anything for granted. So over to you, Li Yang, and Li Yang is the infectious disease program leader at the Swee School of Public Health here at the National University of Singapore. Li Yang, over to you.
Thanks very much, Professor Pang, and it's a privilege to be here, and I would like to thank the Head Foundation for the opportunity. I've been asked to talk about the Singapore experience because, as Professor Pang mentioned, my small country has gone from success to being a lesson for others, and I think it's useful to share some of the experiences that we have had so far. Professor Pang has spoken about this. The virus SARS-CoV-2 was first discovered in Wuhan in China and has since spread all over the world. There are more than 3.1 million cases now and more than 200,000 deaths worldwide. And as has been mentioned, the current strategy is about flattening the curve in order to prevent the healthcare system from being overwhelmed by the influx of cases, which has been seen in a few countries, including in Wuhan in China, where it started, as well as in Lombardy, Italy, and in parts of even the US as well, an advanced economy and nation. So what's the situation in Singapore? I think when we first realized that this virus was going to be a huge problem, some of the modeling done by my colleagues showed that if nothing was done, if we live life as normal, then after about 80 days, we would see almost 1.2 million infections in Singapore. That is about 20% of the population in Singapore would be infected. And then there would be the corresponding number of deaths that would amount to close to 10 over 1,000 or 15 over 1,000 deaths at that stage. And that sets the scene for what Singapore did subsequently. In Singapore, we segregate the cases into 4 categories, and I'll explain why as we go along. There are imported cases which come from overseas. There are community cases, which describes the cases that's spreading in the community. And for the purposes of preventing the infection and delineating the epidemiology, we also split up into 2 categories, which are the dormitory-based foreign workers and the non-dormitory-based foreign workers, all of which add up to close to 10% of the overall population of Singapore, which is 5.6 million. So in January, we had cases that were imported primarily from China as well as from Thailand. And Singapore has an alert system that's called the Disease Outbreak Response Syndrome Condition, which is shortened to DOSCON. Don't ask me why it's called Disease Outbreak Response Syndrome Condition. I think it's a clumsy name, but basically it divides threats into color-coded according to traffic lights, where green means everything is well. Yellow, there are some cases of the disease in the country, but it's still under containment. Orange is where the disease is spreading in the community, but the aim is still to try to bring it under control. And red is a mitigation phase, where we just aim to stop the spread of disease as far as possible. So late in January, when we had the first cases, Singapore went to DORSCON yellow. And then within a matter of weeks, when we started to see cases in the community that could not be linked to any of the imported cases, we moved up a stage to DORSCON yellow, and that's when the population started to be affected by a number of interventions that aim to slow down the mixing in the population and therefore to stop the spread. Then for a period of time, we were doing well until the school holidays, which was between March, I think it is between March 12th and March 23rd. There's a 1-week holiday that we typically have, and this coincided with rapid rise of cases in both Europe and America, particularly in UK at that time. During the school holidays, many parents bring their children traveling, and many of them have booked the holidays way before even the school holidays started. And when they started coming back, we started to see a huge rise in imported cases. And what happened, as you can see, is that Singapore started a whole series of travel bans within a very short period of time. Just over 9 days, and then we have kind of stopped incoming tourists from coming to Singapore, and we have started to put returning residents not just under stay-home notices for 14 days at home, but they had to stay in the hotels. And you can sort of see the effects of that, right? In the sense that imported cases started to fall. But as Prof. Pang has mentioned, if we do not react fast, then the cases will spread, and it's very hard to control it afterwards. And you can see the rise in the orange community cases, which were the results of a whole lot of imported cases coming to Singapore. And then finally, you could see that there was an increase in the number of foreign workers in Singapore having this infection. And finally, on April 7th, the Prime Minister decided that Singapore should go into what he calls a circuit breaker, but essentially it functions like a partial lockdown, where the malls and entertainment venues were all closed, and people gradually had to work from home except for essential services. And big parts of Singapore were shut down, including the schools as well. But you can see that the damage has been done in that sense, because once the virus started spreading in our dormitories, of which there are 43 large purpose-built dormitories that house close to or more than 200,000 workers in Singapore, the cases jumped up to the extent that now more than 90% of the cases in Singapore are actually amongst the foreign workers living in the dormitories. Whereas with the circuit breaker, you can see that the cases are starting to come down in the community to a somewhat more manageable level. There are multiple lines of defense elsewhere in Singapore to tackle COVID-19, and they include surveillance and contact tracing. And this is particularly important at the start. There's all kinds of infection control and prevention measures, both at home as well as in the hospitals. And lately, everybody who goes out in Singapore has to put on a mask to prevent asymptomatic persons from spreading the virus to others. And then there's border control, healthcare, and so on and so forth, all of which were deployed in Singapore. But because of the nature of the virus, in which it could spread even before symptoms develop in a person, and the majority of persons were relatively well, ultimately Singapore required kind of a lockdown or a circuit breaker in order to try to break the spread of, break the transmission chain in the community. And this is essentially what lockdown looks like, right? You can go to Google Mobility and see the differences in terms of mobile data and how this has come down in different countries. And you can see clearly that Singapore, despite calling it a circuit breaker, looks very much like New Zealand or Malaysia or UK, where they have gone into different kinds of terms for lockdowns. The sole exception you can see is South Korea. South Korea is truly a success story, where they have not really restricted movement in the general public, but nonetheless, they were able to successfully bring down a huge initial spread of the virus thanks to its spread in one of their churches. So that's the situation in Singapore. We did put in place many measures to try to protect ourselves from such an outbreak, including a 330-bed National Center for Infectious Diseases. This, by the way, filled up really quickly. And now we're in the midst of converting huge facilities that used to be for entertainment to what we call community isolation facilities, where people who are recovering from the virus can be housed there, separate from the rest of the community, so that they still will not transmit the virus to others. And I show you this very nice picture, which are done by my colleagues in the School of Computing, that shows you all the different clusters of cases in Singapore. And the big clusters are those that's happening in the various dormitories where we are still trying to get on top of the situation. So back to what Professor Pang said, Singapore was successful at the start, but because we were not that quick in anticipating what was coming in Europe and in US, the cases spread amongst our local community. And the vulnerability in our system to date that the virus has uncovered is the foreign workers in dormitories, because many of them are packed in a room. It is very hard to control the spread from the virus there. So while Singapore has fallen off the perch as a role model, and it has become a cautionary tale, but you can see that there are many lessons, hopefully, that can be learned from Singapore, such that other countries will be able to more smoothly manage the spread in their own countries. And with that, thank you very much for your time.
Especially for sticking spot on to your 10 minutes. That, as you probably all will agree, was a wonderful presentation to really sort of emphasize the dynamics of this epidemic in a particular setting. And as Li Yang mentioned, the very rapid spread of the virus. And because of that, this necessity for rapid action, to have the capacity to respond quickly. I'm very impressed with how quickly these community facilities have been set up, tens of thousands of beds, to free the burden from the hospital. Let me just add one other feature of the Singapore response, which I think has been absolutely central to its success. And this contrasts with what's happening in some other countries. And that is strong coordination and focus through an interagency task force involving all the line ministries. Unity of purpose, similar messages to the population, and just very united in what needs to be done. And that coordination mechanism, that interagency task force, was absolutely critical. In contrast, unfortunately, in some countries, that is a problem. In Indonesia, for example, there's a big problem in coordination between the central government and the provincial governors, for example. Brent, you will know that in the United States, that's a real issue between what Mr. Trump wants to do and what the governors of the various states and even mayors of cities want to do. So let me just highlight that as another critical issue in how Singapore has been successful. Okay, so let me move on now to the next speaker. As I mentioned in my introduction, clearly there's a lot of interest, not just in the virus, but importantly in how people respond to the virus. And it's all about the immune response. And no better person to introduce this topic than Professor Zhinan Yin, who is the Dean of the Biomedical Translation Research Institute at Jinan University in China. So Professor Yin, over to you.
Okay. Hi, good morning. Thank you so much for the Head Foundation for giving me this opportunity to share some of the, as immunologist, some of the immune response against this coronavirus. I'm going to touch base on following topics. You know, what this virus, this coronavirus, is the family of the virus with the RNA, and then what's the host receptors, and what's the immune response, and are there any drugs, and also the status of the vaccination, and how can we stay immune healthy. So this virus is the RNA virus. So it's very similar to the SARS. It belongs to the similar family. But this virus was much higher spreading rate, and it was 2 subtypes so far. So this L type and S type. So that means the virus has been, mutated already. So with the longer the virus stay, among the human beings, might be the mutation rate will be higher. So the host, the origin or the intermediate host are unclear. So for this virus. So the host receptors so far has 2 receptors. So one is this ACE2, which shared with SARS. But recently, a Chinese scientist defined the CD147 is a Ig superfamily glycoprotein, also as a co-receptor for this virus. So what's the smart of this virus is, not only this virus use ACE2 to enter the host cells, but recently the scientists from Harvard defined ACE2 as interferon-induced gene. As you know, when the virus comes to the host cells will produce interferon alpha. And this interferon alpha try to clean the virus. But for this corona-19, this interferon alpha can in turn enhance the level of ACE2, so promote the virus spread. So that's the danger of this virus. Use ACE2, use interferon alpha. So as any other virus, so the immune response with innate immunity and adaptive immune response with neutralized antibody and the cytokine storm. It's very uncommon. However, for this COVID-19, we're not so sure what's the key of the immune response. We only know with the mild diseases, so you have some of the lymphocyte reduction, but in the most severe cases, they have a lot of inflammatory cytokines, we call it cytokine storm. So another thing that I have to mention is they call the antibody-dependent enhancement, they call the ADE effect. So if the antibody was not a high affinity, we cannot neutralize the virus, then this antibody will help the virus. So that's called antibody-dependent enhancement. So that's also the danger of certain vaccination. So if we have vaccination cannot produce high affinity neutralizing antibody, then you might have an ADE effect. So with the IL-6 is a key for cytokine storm. So in China, also in some other places, we use anti-IL-6 receptor antibody has successfully treated severe diseases patients. So this is one of the signs. Are there any drugs at the beginning in China or in other places has tried a few drugs, and so far no drugs are effective. So all these clinical trials are failed. So about this is all the articles published already so far. At the beginning, especially the chloroquine. So with the US, with China at the beginning, try to promote chloroquine. But right now, clinical trial come out, no any beneficial effect. And the vaccination on the way, but it's a long way to go. So we have 5 different kind of vaccination so far, with recombinant protein, with inactivated virus, and with RNA as well. So we'll have to wait to see. In China, phase 2 trial has been on the way. So end of May, we might see some of the results. We have to wait and see. So finally, how we can overcome this virus? heavily depends on our immune healthy. So this is the 7 way to harm our immune system, of course, or lifestyle. So we have to keep healthy immune response or immune healthy. You have to have to manage your stress. You have, lifestyle with eating, with appropriate activity and sleeping, and also have your reduce your stress. So I have to mention like a high salt, can ruin your immune response, and high fat, of course, obesity is chronic, inflammation, and also exercise, of course, is one of the best way to improve your immunity. Enough sleep or, quality sleep, low sleep can, drive your inflammation. Finally, the depression, with this coronavirus, everyone is talking about, all the media every day, have to face. So I would, conclude, say, if you stay immune healthy, the human being finally can overcome the war against this virus. And thank you very much for your attention.
Professor Yin, for that wonderful expose of the sort of the more immunological dimensions. I think you highlighted very nicely the approaches that's ongoing now in terms of vaccination. But I think importantly, you also highlighted the risk, and your point about antibody-dependent enhancement is a very important one, because it brought to my mind a similar problem that was faced with the dengue vaccine that was introduced in many countries about 3-4 years ago. And once again, the same phenomena of an antibody actually enhancing the infection rather than neutralizing the infection became a real problem. Okay, thank you for that. No drugs, no vaccines, but people still have to deal with it. And Professor Yin's final slides on staying immune healthy, I think brings us to a very nice way to introduce Professor Brent Bauer, who is the director of the Complementary and Integrative Medical Program at Mayo Clinic in Minnesota. And I think building on what Professor Yin finished on, Brent is going to take us through some other perhaps alternative strategies that will maybe in a way complement conventional medicine while we wait for a vaccine, while we wait for effective therapeutics. So over to you, Brent.
Well, thank you, Dr. Pong, and Dr. Yin for setting things up very nicely for me. And also thank you to the Head Foundation for this opportunity to share some thoughts. And I think this is exactly where we are, at least in the integrative medicine program here at Mayo Clinic. We're taking a lot of phone calls and seeing a lot of patients, but also a lot of people who are still healthy. And their real question is, how do I stay healthy? How do I build my resiliency? And so what I'm going to do is just share some concepts from integrative medicine. These are things we bring to patients on a daily basis before coronavirus, but I think in many respects will now be seen to be even more integral as part of a combined approach. This is where we can take the best of both worlds and let evidence guide us to help strengthen both our patients, those who are still healthy and wish to avoid the virus, and then also think about our colleagues who are in the trenches, seeing patients every day dealing with the coronavirus. For those of you who are not familiar with the term integrative medicine, I'm using here the definition from the Consortium of Academic Health Centers. This is a group of about 75 medical schools and academic medical centers in North America. I like this definition. It basically calls integrative medicine a medicine that focuses on the relationship between practitioner and patient, and note it doesn't say doctor and patient, it says practitioner and patient. So that brings a lot of us to the table with a lot of different skills, focuses on the whole person, and is informed by evidence. And that's critically important, as I'll show in a few moments, but then makes use of all appropriate therapeutic approaches, professionals, and disciplines to try and achieve optimal health and healing. So this is a concept that has evolved. If you would have asked here in North America many years ago about other approaches, we might have used the term complementary medicine, alternative medicine, CAM, and we really defined all of the things that we didn't normally include in conventional medicine under this rubric. So things like meditation or massage, herbs and dietary supplements, yoga, acupuncture. And of course, what's happened over the last 20 years is research has really grown and showed us how to integrate these successfully, not in place of, but in conjunction with conventional medicine. So I think it's very important that everything we've talked about already, some of the diagnostic testing, some of the novel therapeutics that are being developed are critically important. But we have this other side of the question of how do we optimize resiliency, both for those who have not been infected, but also for those who may be recovering. How do we help optimize healing for those individuals? Well, even before the coronavirus, we spent a lot of time thinking about how to optimize wellness. And this is an older study, one of many. I'll just share briefly. But this is one that actually looked at telomere length and its response to lifestyle interventions, such as Dr. Yin just mentioned: low-fat, whole food-based diet, daily aerobic exercise, 60 minutes of a stress management or mind-body program on a daily basis, and a formal support group in older gentlemen with prostate cancer actually led to a statistically significant improvement in telomere length. And we usually include, in addition, sleep and spirituality as other elements, but those 4 elements plus the 2 additional ones are what we consider a foundational approach to optimizing health, building immune resiliency. And this is what we've taught many patients over the years, even before the coronavirus. But I think this becomes especially important in the time of the coronavirus because of the effects of stress. And again, Dr. Yin alluded to this. We won't spend a lot of time. This is just a quick slide summarizing about 30 years of experience looking at research on stress. I'll just highlight 3 things in particular. Under chronic stress, we know individuals are more susceptible to infections, colds, and flu. We know we have decreased immune function, and we also know that chronically stressed individuals have a less robust response to vaccine responses. And if we go back even a little bit further, in 1991, we have this interesting trial from Dr. Kuan and colleagues where they actually inoculated viral particles, including coronaviruses, along with other influenza viruses, into individuals, and were able to show that those with higher levels of stress had a much higher rate of uptake or infection with the virus. So I think this gives us a lot of reasons to think lifestyle can be important, especially where it impacts stress. And so we won't think of everything that is under integrative medicine because that would take hours. But if we just think about that mind-body approach, what are the things that can affect us from a stress management standpoint? I'm just going to highlight very quickly some of the things we offer routinely. Massage, of course, being a very important one. This is just one older systematic review suggesting efficacy for anxiety and stress in patients with fibromyalgia. The literature is very strong in terms of the effects of massage on stress. We also are looking at Tui Na as something we're offering more and more to our patients here. We are collaborating with some of our colleagues in Singapore and China to do a multi-center evaluation of Tui Na for low back pain. But there's also a number of studies out there already suggesting that Tui Na can help reduce stress, both in healthy individuals and individuals with underlying disorders. And then acupuncture, we see a lot of benefit from acupuncture for pain, but in many of the studies validating that, we also see reductions in stress and anxiety. And I'm highlighting here just a study from Sweden where the primary outcome was actually stress. So we think within integrative medicine, we can offer things like massage, Tui Na, acupuncture, but of course, right now we have this challenge with social distancing. So what else can we do? Well, we've been very successful, or at least I think we're becoming successful with delivering other interventions through virtual classes, electronic downloads and so forth. Yoga being one, again, just highlighting a systematic review showing the benefits of yoga in terms of stress, improvement in quality of life, reduction in depression. Tai Chi certainly has a number of studies looking at benefits on anxiety, depression, stress. Also, obviously, for older folks, reductions in the risk of falls. So again, as we start to ask the question, what can we bring to our patients? What can we bring to ourselves? What can we bring to our medical workers? These are things that we can actually deliver without having to be face-to-face with the patient. And certainly meditation, number of meta-analyses, studies out there have shown that meditation can be very effective for reducing stress, improving quality of life. And along with that, we also use a number of other mind-body practices such as guided imagery, different breathing techniques. We're seeing a number of commercial devices that help with biofeedback, whether it's heart rate variability or EEG tracking. So again, there's lots of things that we've been able to deliver virtually or electronically to help our patients, our consumers understand that there are things they can do in addition to nutrition, exercise, social connection, spirituality, and sleep. So we're just focusing on mind, body as one element that I think integrative medicine brings to the table, not as an either or, but really as a both and. We want the best of those conventional approaches we've just been hearing about, but we also want to think of the person in front of us and how we can help them mitigate at least one aspect of this, which has been a tremendous rise in levels of stress across multiple populations. So looking at integrative medicine, things like massage, tuina, and acupuncture may have to wait for social distancing to wind down a bit, but we certainly can talk about Tai Chi, yoga, meditation, and other forms of mind-body practices that can be taught and are being successfully taught and shared through electronic means. So again, I think that we have some things to think about in terms of building immune resiliency and building resiliency of folks who are recovering, helping people prevent infection in an integrated fashion, combining the best of both complementary and conventional approaches. So I thank you for your time, and I'll leave you with my email in case there's questions we don't get to address during the question and answer session.
Well, thank you very much, Brent, for that wonderful overview in the context of focusing on the well-being of individuals, which I think is very, very important in the context of all the focus, perhaps undue focus in some ways, on the more medical kind of interventions in terms of both public health as well as vaccines and therapeutics. Well, thank you very much to all three of you. I think you have been very, very, very good in terms of sticking to your 10 minutes. So my instructions are basically to maybe spend a little bit of time between the four of us in case we would like to raise some questions between the four of us. And then after that, we can open up to general Q&A. I can see a lot of questions coming in already. But before that, let me just ask the three of you whether there are any questions that have come up in your own minds as you listen to the other three speakers. Anyone would like to begin? Liang, okay, go ahead.
Yes, I'd like to ask Professor Yin, please. I think there's a lot of concern now that we may not get a vaccine that is effective and that will not last a long time because there's really very little long-term immunity to coronaviruses. So what's
yes, this is
take
great
on this
question.
matter?
Actually, in this issue of nature and also in this issue of JAMA, the editor has been warning the people we cannot jump to vaccination so fast, since we did not understand the immune response very well against this virus. Because at the beginning, this virus comes so fast, only very few studies has monitored the immune response at a different stage of diseases. So, the antibody test, as some of the speakers mentioned, there's two different methods to detect antibodies. One is a simple, quick test. One is more sensitive. So most of the public study right now, they use basically point of care test, which is not that sensitive. So we don't know how many people recovered from virus have the antibody. And we don't know how many these antibodies are neutralized antibody. So we have to wait to see.
Okay, thank you, Professor Yin. And I think that is absolutely central that I mentioned, that we still have a lot that we don't know about what are actually the correlates of protective immunity. Now, that obviously highlights what Dr. Bauer mentioned, that while, you know, we cannot at this point think of a magic bullet, either in terms of a vaccine or a therapy, that's all the more reason at the level of individual, we need to continue to be resilient, you know, using the variety of techniques. Just to a question. My question is to you, Liam. Do you have a view about why in most countries in Asia, we have not seen this massive explosion and large number of deaths that we have seen in Italy, in Spain, in Iran? Why have we not seen that? Of course, with the exception of the early situation in Wuhan. But by and large, most countries in the region, even India at this point at least, have been spared that very rapid, very massive explosions with tens, thousands of deaths happening daily. Do you have a view on why that is not happening in Asia?
I don't have an expert view on this, Professor Pang, and you probably can answer this better than myself. I know that for countries or territories like Taiwan, Hong Kong, Singapore, South Korea, because we test extensively, our numbers are a better reflection of the actual cases on the ground than originally in Europe or US. So the deaths are correspondingly lower. It may well be that in countries like Laos and Cambodia, I've been in touch with them. The epidemic, the pandemic has started later, and they have also implemented measures. There's a question that some degree of the lack of availability of testing, even at this point, may also constrain them in diagnosing deaths due to COVID-19, but their hospitals are not really overwhelmed. So it is quite puzzling.
Okay, thank you for those insights. I have just one additional point to make, and I've read that one of the other possibilities is the demographic. If you look at the countries in this part of the world, the population that's age 65 and over is between 5 to 7%. Whereas if you look at Italy, Germany, Spain, that part of Europe, it's close, it's more than 20%, sometimes as high as 25%. So it may be another factor in the demographic that's resulting in this. Okay, Brent, I have one question for you. You've highlighted a lot of sort of complementary, integrative approaches that can be utilized, and you've cited good evidence as to how it might work. Do you see that there is a sort of a context specificity to the application and availability of these interventions in this part of the world? You know, I believe, for example, Tuina and acupuncture, traditional Chinese medicine, focus has been really on China, but presumably, do you see other alternative interventions that might work in different parts of the world? I don't know, maybe Ayurveda in India, for example. So some views on that?
Yeah, I think that's a great question. I mean, I think we have to be careful. Much of what we take from a traditional Chinese medicine perspective, or what we might take from Ayurvedic traditions or Korean medicine, Kampo, I think we find pieces and we bring them in to a different culture. Sometimes they work and sometimes they don't.
Right.
And that sometimes is because we're not taking the full tradition. We're not bringing everything together. I know oftentimes we do studies of acupuncture with just acupuncture, but we haven't addressed diet, nutrition. We haven't looked at pulse and so forth. So I think there's a good and a bad. We want to be as quick as possible to adopt those things that can help improve health, but we also have to be careful we do it in a way that doesn't miss the value when things are provided in an integrated fashion.
Okay, so it's surely not a question of one size fits all and that all these interventions will work equally in different parts of the world.
Right.
Okay, very good. I'm now going to, in the remaining time that we have, and I'm not sure, I think we have about 40 minutes or so left. I already see about 49 or 50 questions on the Q&A. And I'm gonna try to sort of go through them and perhaps direct some of them to some of you. Let me begin by this question, which probably is going to be directed to you, Liang. Do you think that the general population in Singapore is too complacent about the virus, considering all the cases where people were gathering despite all the warnings from the government? And before you answer, Professor Yang, to what do you credit the very low death rate in Singapore? We have a much lower percentage rate than other countries. So 2 questions for you.
Thank you. Let's deal with the first one first, which is trickier. I think human behavior has generally been the same everywhere. There has been a subset of people, and that's a very small minority, who do not take COVID-19 seriously. That's not just in Singapore, but anywhere else in the world as well. And unfortunately, what these people have done have been amplified thanks to social media and even on the mainstream media. And so you get a sense that maybe people don't take it seriously. But I can assure you, generally, most people in Singapore and in most countries take COVID-19 seriously. And they take the measures that are implemented very seriously as well. With regards to the second question, there are two parts to this answer. The first is that, as I mentioned, because Singapore tries to identify every case as far as possible, and Singapore does test aggressively, the testing per capita is one of the highest in the world. Therefore, we pick up more cases, and by proportion, there will be fewer deaths. More importantly, something Professor Pang has mentioned as well, the vast majority, 90% of the cases have been in foreign workers who are young to middle age. All of them are healthy, and we generally expect the death rates for this particular population to be far lower than 1 in 1,000 persons. So that's why Singapore's death rates, I think, are low at this point in time.
Okay, thank you very much for that. My apologies to people who have submitted questions. I'm just going to sort of pick and choose because it's obviously not possible in the time that we have to answer all of you. But the next 2 questions are probably for you, Dr. Yin.
Yes.
The first question is, can you explain what is the connection between SARS and COVID-19? And the second question related to this is, let's see, there was a question on a specific, given there is no drug and no vaccine, is herd immunity the ultimate way for protecting human populations? So that's the 2 questions for you, the link between COVID and SARS and herd immunity. Over to you.
Okay. So the first one, actually the S protein, the spike protein of the virus, these 2 have a 70% homology. So that's it. So they share the same receptor, ACE2. So this is the link between these 2. But of course, from the structural point of view, the spike protein of COVID-19 has 200 times higher affinity than SARS. So that's why, the the ability to transmission is higher, COVID-19 than SARS. So SARS disappeared, but now most of the immunologists believe this virus probably will, remain, among human beings for a long time.
Yeah.
So that's bad news. And in terms of the relationship between immunity and the severity of diseases, is from the common right now from this population study. So the age 50 or age 60 is one single factor to predict the survival curve. So the aged people with basic, diseases, phenotype, with lower immunity, for example, cancer patients, chronic diseases like diabetes, vascular diseases and so on. So with lower immunity, the worst outcome. However, there's a very small fraction of people, even with a very high, with good healthy, also have these severe diseases, which is cytokine storm. So we need to find, to discover the biomarker to predict the outcome. So in general, yes, better immunity, the better outcome. However, have some exceptions. So we do need to find the biomarkers, and we do need more basic research.
Right. Thank you very much. And obviously, the question of herd immunity, and you mentioned biomarkers, the R naught is obviously very, very important, because depending on the R naught, you probably need to have sort of a certain percentage of the population to be exposed to the virus before you can achieve that level of herd immunity. Okay, thank you for that. Brent, I have a couple of questions for you. The first one is, Dr. Brent, how about spirituality as stress relief? I've read a few research papers that say it has a positive effect to reduce anxiety. And second, could you elaborate a little more on traditional Chinese medicine and how it can mitigate the sort of the clinical illness as well as overall well-being?
Yeah. Well, as always, great questions. There's a number of studies on spirituality that obviously predate coronavirus or the current pandemic, but most of them point to a very favorable effect. People who engage in some spiritual honoring practice. So it may be religious, but it doesn't have to be. There's different ways to incorporate spirituality, but almost all of them come back and show improved quality of life, reduce stress, reduce anxiety. So I think as we think about how do we build our optimal resiliency, it's going to have to include some way to honor spirituality in addition to nutrition, exercise, and so forth. In regards to traditional Chinese medicine, I think that's a great question. I've seen a few studies or I guess more at this point, case reports of hospitalized patients being treated with TCM concoctions, herbal preparations, most of which contain ginseng, but also a number of other potentially immune stimulating, with anecdotally very interesting results. I've seen a few trials where people have looked at other herbs as a preventative. They're all very intriguing. Obviously, what would be most intriguing is what would happen if we had the full force of a traditional Chinese medicine approach with herbs, with qigong, with perhaps tui na, perhaps with dietary guidance and so forth.
Yeah.
And I know there's some places that are working on those, but I don't know of any published results yet that we can point to and say that we have clear guidance yet.
Okay, that illustrates very nicely your point about integrative and holistic. And as we all know, and from my years at the WHO, there's always been the perennial question about sort of the veracity of the scientific evidence in terms of, sort of randomized clinical trial standards that some TCM studies have not been able to achieve. But obviously what this COVID-19 is pointing out to, in future, we need a lot more research in that area to sort of build the evidence base of knowledge. Okay, thank you, Brent. Okay, Liang, a lot of questions for you. Okay, this next one is going back to CD's warning earlier, not to touch on sensitive area. I don't think this is a sensitive area, so I'm going to ask you anyway. I have my own views on this, so we can discuss. So the question is this: Professor Zhu and Professor Pang, why do you think Singapore did not anticipate the risk in the foreign worker population? Or did they anticipate it but just didn't address it? What lessons might there be for other countries with regards to how they think about and proactively protect their vulnerable population? So it's not just obviously foreign workers, but refugees, people in elderly care homes, people in prisons, for example, etc., etc. So over to you, Liang. Any views on this anticipation issue?
Thank you so much for such a difficult question to answer. I can't speak for the governments, of course, and for the Ministry of Manpower. I think it has been raised a number of times that the foreign workers in the dormitories might be a potential risk. I'm not sure the warnings came in time, even if the government truly wanted to do something about it, sort of segregating out the foreign worker population from others. As you can see, even now, as we try to improve the physical distance in the dorms, it hasn't been very easy to shift almost 200,000 workers to alternative accommodations that can help. But I think it could have been a systemic blind spot, not just in the authorities, but in the rest of Singapore, where we have tended not to really see or truly understand such people. And I think moving forwards, this is something that's very important to address. There are groups now that's working to come up with what should be a practical way of building dormitories that is still cost effective and can still minimize the spread of the outbreak. And there are other groups looking to see how these people can be integrated with the rest of the community rather than living apart they do now. But Professor Pang, I'm very interested in your insights in this as well.
Okay. Thanks, Liang, for that view. My view is actually as follows. I think it's easy to criticize in hindsight. Okay, why did you not see this coming? My view is that in the early days of during the first wave, when large number of imported cases were coming from China and elsewhere, I think the interagency task force had its hands full really with dealing with that influx of imported cases and sort of protecting the local population. So I don't think it's an oversight. I think it's a question of what fires were bigger at that point in time. Okay, so it's a question of having to deal with so many different fires in a very sort of short time frame. So I sympathize with the government. Having said that, when it became clear that it's going to be a problem, I think the reaction has been exemplary. It's not just exemplary in terms of acknowledging that these foreign workers need to be taken care of. It's actually action to take care of their health, to make sure to reassure them that they are going to be continued to be paid their salary. They're not going to lose their jobs. They're going to be provided with food, with healthcare. They're even provided with Wi-Fi. So I think the government has taken a very humane approach in this case. And there was a case of one of these foreign workers committing suicide. They took that into control very quickly to reassure all the others, to prevent any sort of, maybe dissatisfaction, social unrest, etc. So that's my point of view. It was perhaps, a little bit of a late reaction, but in light of what they had to deal with early on, I think they've responded very well. I said that just to make sure that my employment pass is not cancelled after this webinar. Okay, thanks. Liang, I have many more questions for you, but let me get back now to Professor Yin, because I'm also seeing, actually I'm seeing a lot of questions for all three of you, which is very encouraging. So Professor Yin, we seem to see that a person may get reinfected by COVID-19. I think there was a lot of data out of Korea that shows that people who were tested positive then became reinfected. So this person said herd immunity doesn't seem to be working. In that case, it seemed a good vaccine is the only way. Would you like to respond to that?
First, I would like to comment on the re-positive test of RNA. So, you know, some of the virologists believe that might be, you know, we don't know whether the live virus or just the RNA from a virus. So we have to be careful to interpret the result of the re-positive of nuclear test. Because right now, we only use the RNA derived from virus and through this PCR technique. So I have to comment on that. But since, as I mentioned earlier, we do need to understand the immunity, you know, the true immunity, whether the cellular immune response or antibody response, or both are required, like HIV. So the vaccination probably take a while to fully develop. So far, all the, you know, at this stage, the vaccination try to develop antibodies against the virus. So as I mentioned, also ADE effect. So if you have a high affinity antibody, might be a neutralizing antibody. If a low affinity antibody might have the ADE. So we don't know whether we need T cell response. If we do need a T cell response, the vaccination is more complicated. So that's what I have to say.
Thank you, Dr. Yin. And I think, as always, the tendency, I think, even amongst immunologists and public health people, is to always assume that it's antibodies that's key. But in this case, you know, being an immunologist in my past life, I believe that there could very well be a role for T cells in this kind of situation. Let me just make a comment on this issue of reinfection. I'm going to play the devil's advocate here, and I'm going to suggest that it was not a case of reinfection, but my view is there could have been a problem with the test result in the first place, okay? So in other words, the first test was not actually a real positive because there are many possibilities there. For example, was the specimen collected properly, okay? Was it stored properly before it was sent to the lab? Was it collected in the correct part of the respiratory tract to ensure that there was enough virus there? Okay, so I tend to think that, you know, those first few positive that then became reinfected were not really positive in the first place. I mean, it's just a possibility, another sort of possible explanation, because as an immunologist, I find it very difficult to really accept the fact that someone who's infected can then be reinfected in a matter of days or weeks. But once again, maybe it goes back to what Dr. Yin, what you said, maybe it's not antibodies, okay? But let's not go into that. Some questions again for you, Brent. Very interesting questions here, and I'm not sure whether you're comfortable in answering this, the second question at least. The first one is fairly straightforward. Has the Mayo Clinic integrative medicine intervention been used in Asia? And do you have studies of its impact and efficacy? So that's the first point, referring to the various strategies that you refer to. And secondly, and actually this is not directed just to Brent, but to the other two, do music, dance, theater, painting, etc. have a clear effect on patient well-being and healing? Okay, Brent, you have a go at that in terms of the Mayo Clinic.
I missed the second question. My internet went out.
Yeah, the second question is, does music, dance, theater, painting have an effect on patient well-being and healing?
Well, I'll take the second one first because that's a great question and it's a fairly
Yes.
easy one. The answer is yes. So again, there's a number of studies looking at music as well as music therapy. So music can just be listened to. Music can also be performed or presented by a music therapist. We've done studies on both. We found beneficial effects. We have
Oh,
music
wow.
therapists at the bedside, available to children and adults in the inpatient. We've done some studies with art, bringing artists to the bedside and been able to show significant reduction in stress and anxiety in patients receiving chemotherapy. Having dogs visit patients, using journaling. So I think the question is less do these things work, and more importantly, which one works for which patient. So that's been my approach to try and have as many things that are evidence-based as possible available, and then try and let the patient tell us what works best for them, what fits for them culturally the best.
Okay, excellent question. What about the first one about whether the interventions that you mentioned that Mayo Clinic has been investigating, has that been tested in Asia? Any studies on its impact and efficacy?
Well, you know, it's an interesting question because many of the things we're studying are things we've learned from Asia or from other cultures. So things that we've integrated and we consider what we would traditionally bring to a patient's bedside: acupuncture, massage, meditation. Many of these are things that came to us from Asia. So I don't know that we have created a special program or anything novel. What we're trying to do is make an evidence-based approach to each patient so they can choose of those things what works. But I don't think it's any different really than what is going on currently in many of the hospitals and medical centers in Asia or other countries around the world, to be honest.
Okay, thank you, Brent, for that. Just a quick follow-up, Brent, since you're on the line. Another question is, would you say practicing good mental health is more important than ever, since reducing stress and anything from the outside is just as important as anything that could affect you from within? I think great question here. If so, is it wise to practice this alone now with social distancing without a professional present to guide you away from more harm?
Yeah, you know, there's no question stress is ubiquitous. Stress has been a huge impact on health across the world. We're seeing stress levels rising everywhere, and that's all before we had a pandemic. Now what we see with that pandemic is people being forced into isolation. Isolation and loneliness have been studied, and studies have shown chronically lonely people have genetic manifestations. Genes are turned on, genes are turned off just from being chronically lonely. So I think this forced isolation, these old people who are not being able to be taken care of by their extended family, huge implications. So absolutely, I think mental health needs to be front and center. And to the point, everything we do has to be evidence-based and it has to be safe. So that's why we try and pick and choose those modalities that we can deliver electronically that anybody can use without engendering a lot of risk or concern.
Absolutely, and I think that is a very important point about mental health and well-being, especially amongst the vulnerable groups, the elderly, for example. Liam, going back to you, the Singapore, Indonesia, Malaysia, and Philippines, Thailand, for example, have very hot and humid tropical climates. Question to Professor Zhu: will weather play a role on the community transmission of the virus? I think there's been many sort of debates about the role of climate and weather in survival of the virus. You want to have a go at this one?
I know the initial hope was that summer would bring an end to the virus, but I think that the virus spreads so efficiently, and no one has any real immunity to the virus at all in the community. And therefore, I don't see the weather affecting the spread of the virus significantly, at least during this first couple of waves as it spreads around the world.
Yes, I agree with you, and I think the rapid spread of the virus, even in temperate climates, is proof of that view. Just my own view, I remember seeing a lot of people on the web, for example, saying, you know, the virus can survive at this temperature under this condition for a certain number of hours. But when I looked at that a little bit, a lot of those studies are done under very controlled laboratory conditions. Okay, and I'm also always very suspicious. What actually happens out there in the real world may not extrapolate from a lab kind of situation. So that's why I agree with you, Liang, that probably given what's happened already, that we can probably put that as possible, but maybe not probable. Okay, we have another 10 minutes or so. Professor Yin,
Yes.
can you help to clarify why there is such a long time to arrive at a vaccine? We have so many scientists working in all countries, including China, as you mentioned. Are we approaching this commercially? Is it due to lack of collaboration between teams within a country and globally? And the second part of the question is, will the existence of virus variants and mutation that you mentioned in your presentation delay the development and success of the vaccine?
So against the virus, we have some very successful vaccination, but we have been trying to develop vaccination against HIV, for example, but no success. So different virus, we have to use different strategies. So far, commercial resources or universities, I mean, this time in China, the government put a lot of effort. Right now, inactivated or hate-killed virus has been used so far for phase 1 trial. And also recombinant protein has been, past the phase 1 trial so far. So we have to wait to see. 500 people have been injected. So we will see the first, results in May, end of May. So this has been quite fast because, you have to manufacture the recombinant virus, the recombinant protein. So with the GMP facility. So I think this is the faster we can go. Given the property of vaccination, the safety is the top priority. So we have to prove the safe. Now, safety passed. Now we have to see the efficacy. So we have to see the antibody titer. We have to see the antibody really can neutralize the virus. So we will see the end of May. So if that's the case, then we have to do a large scale of study, more than 3,000 people. So, and the real challenge is, even if you have the antibody, we have to inject the people with the virus. So that have to be on a very restricted condition to do the phase 3 trial. So that's why, take really a long time to develop. Of course, the full collaboration among the scientists in the world is so important, and we have to keep all the information transparent, and we have to keep all the scientific information transparent to all the community.
Okay, thank you very much for that insight. I just have a couple of comments on vaccine. Obviously, the most important thing in terms of why is it taking so long. Vaccine development is very complicated. As many of us know, the most important thing is we need to make sure it's safe. We need to make sure that it actually works, that it's effective. There are additional questions on who gets the vaccine, issues of equity and distribution, the issue of affordability, all these issues. And that process, until you get regulatory approval that the vaccine is safe to use, can take anything up to 12 months to a year. In terms of the variants, going back to what I mentioned earlier, it is, I think, important to also note that like what's happening with seasonal flu vaccine, if there are variants, and if those variants are dominating in certain parts of the world, a future vaccine may need to have the composition reflecting the different variants. So that, in a way, adds to the complication. But once again, as Professor Yin mentioned, we don't yet have enough information at this point in time to address those kind of issue. But obviously, that's something to be considered in the coming. Okay, just maybe we have chance for one more question. I go back to Liam. A lot of questions. Obviously, I think a lot of participants here from Singapore. Professor Zhu, I wanted to find out what is your view on segregating the infection numbers between local cases in community, dorm workers, work permit, living outside of dorms, etc. Will this artificial separation be beneficial for society?
Thank you. That's a very good question.
Yes, excellent.
But I think if you look at the numbers that are projected on Worldometer, for instance, or Wikipedia or WHO, it's just one number, right? So all of these cases, whether they are foreign workers, residents, citizens, they're all counted together. For the purposes of highlighting groups where there are differences in the way the virus transmits between persons and where the preventive measures are necessarily different, epidemiologically speaking, it is useful to list out different groups in our community, and the figures therefore reflect that as well. Professor Pang, you have an opinion, I'm sure.
No, not really. I think it's once again a situation where how you categorize those cases are obviously important. I mean, you need to disaggregate and separate to identify, you know, some strategies may be more important in some groups than others. So once again, I think if this is the way the Singapore government has approached it, and as Brent highlighted, this is based on the data and on the evidence. And once again, this is based on what we know now. Time will tell whether it's the right strategy. Okay, just one final question perhaps for Brent. There have been media reports and showcase that spoke about China using traditional Chinese medicine as herbs at the hospital, and also prescribing for those who are currently discharged. Are they focused on curbing symptoms or building immunity? What, in your knowledge, are these herbs made of? I think you've already mentioned ginseng, but obviously, clearly TCM has a lot of supporters and practitioners in this part of the world. So any response to that question, Brett?
Well, only to admit that I'm not an expert, but I have seen, and we have a fellow here at Mayo who actually spends part of his time in China, and he's actually works with some of the critical care research done here at Mayo. He's looked at a couple of different traditional Chinese medicine formulas. They've used it in patients who were critically ill, and at least in a very small number of studies or a small number of cases, seem to see some very encouraging results. I know he's also used different formulas to help aid in recovery, but honestly, I don't have any deep knowledge in these areas. I just know that studies are going on, and that I suspect we'll find some formulas emerging that will probably find a place to help people either prevent or treat symptoms or recover.
Oh, thank you very much for that. My obvious reaction is this really points to the need for maybe another webinar to look at this in more detail. Okay, well, I'm cognizant of the time. So I would like, first of all, to apologize to all the people who have asked questions. There are just so many, and I've tried to sort of distribute them across the three speakers. Just have 2 or 3 minutes. I'm not going to try to really do a good summary of the excellent presentations that I've heard, but let me just perhaps make 3 sort of concluding points here. So just very quickly, just in terms of what I've learned from this today, you know, my first reaction is really that a rapid reaction to deal with the dynamics of spread really, I think, as illustrated by comments and questions, needs leadership, good governance, political commitment at the highest level on the health system, social capital, and good governance. The second lesson is that we clearly need to know a lot more. We need a lot more research to better understand the immune response, to develop safe and effective vaccines and drugs. That's obviously a big challenge for the future. And I think we ended on a very nice note to sort of complement the conventional public health medical approaches with alternative sort of integrative approaches, which focus on the sort of holistic resilience of individuals. I think that was a very good point that was highlighted today. Staying healthy, good hygiene, reducing and managing stress and depression, making sure you eat healthy, spiritual dimensions, the role of the arts. And let me finish by quoting Singapore Foreign Minister Vivian Balakrishnan, who said this during a CNBC interview. We need a tripod of quality healthcare, good standard of governance, and social capital as foundations for effectively dealing with the pandemic. I think he captured the key ingredients very, very nicely. So we've come up exactly to 11:30. So let me just make some comments at the end to sort of, first of all, thank the three of you, Liang, Jinan, and Brent, for your excellent contributions. Let me thank the audience who have participated very actively in terms of your very good, insightful questions. I just regret we couldn't answer them all. Perhaps we can work with the foundation to at least perhaps catalog those questions. And my final comment is also to thank the staff of the HEAD Foundation, who have really been very focused to make sure things went on smoothly today. And the final comment for today is to highlight you to the fact that the HEAD Foundation is planning a series of these webinars. We have talked really about sort of the health, medical, human side of the COVID pandemic. But from what I've heard today, we could have another webinar, for example, on the social impacts. We could have a webinar on the political impacts of COVID. We could have one on the economic impacts and globalization impacts of COVID. So just to alert you that the foundation is thinking of having a series of these webinars, and we might be tapping on you again. So thank you very much. We can't shake hands, but thank you very much for all your contributions, and stay safe, everybody. Thank you. All right.
Thank you for being such a great moderator.
Absolutely.
Thank you.